Welcome back. As promised, we're joined by Governor Doug Ducey. How are you holding up?
I'm holding up. I mean, focused.
Yeah.
Every day. There's a mission.
I'm looking. I don't see any gray hairs in that head.
You look closer.
Let's talk about testing, because I think that's still first and foremost on everyone's minds. The president says states need to step up the testing programs. Many would make the argument that it should be a federal rollout because they have better resources, but nonetheless, he's putting it on the states. So do states like Arizona really have the resources to get testing to where it needs to get to?
We have the resources to get this done. Now we're investing them so we have the products, the reagents, the swabs, the things that are in short supply across the country. There's not a governor in the nation that isn't out there trying to find what they need to get these tests done. We had some good news earlier this week with Dr. Bobby Robbins from the University of Arizona. They're going to be able to do 250,000 of these antibody tests. Now, we've done 50,000 to date in Arizona, and we're ramping it up rapidly. These tests will tell you if you've had COVID-19 and you've recovered. And that's really something unique to know, because you likely have immunity for a year going forward. And that type of information and data is what we're going to need as we make decisions about how to slowly and properly and responsibly reopen the economy.
Most estimates say that as a country, we've tested about 1% of the population, which most experts believe is not enough. So as you look at reopening an economy like Arizona's, my fear would be that if you send someone back to work who is asymptomatic but has had coronavirus or has an active case of it, and they haven't been tested, we're right back to square one.
And this is why we're going to follow Dr. Fauci's lead. One, we've made a lot of improvements since square one. The social distancing that we've had in Arizona, the stay home, stay healthy, stay connected directive, Arizonans have been great. They've been listening. And you saw the report just before I came on where we are in terms of projections. I mean, Arizona, what we focused on was having the proper amount of supplies and hospital beds and ICU beds and ventilators. So whatever's going to come our way, we're prepared. But right now, it looks like there's no surge in front of us.
All right, but will we ever get to the point where anyone, the famous quote, not only by you, but by the president and many others, anyone who wants to test will be able to get one? Are we ever going to get there?
Well, yes, we will get there. But I also want to say, this testing is not a cure-all. I could take a test right now, which I have not taken. I could test that I don't have COVID-19. And on the way out, I could open the door and contract it.
Sure.
So what good is that test in that situation? It's more the social distancing. And Mark, if somebody in our age and category gets this, we're going to be sick and down for a few days. We need to be concerned about our most vulnerable, 65 years old with underlying health conditions, doctors, nurses, emergency medical responders, first responders. These are the people we want to prioritize for these tests.
I get it. But again, if you send someone back to work, if I go back to work, I'm at work. But if we have everyone here and I'm asymptomatic, then I start spreading it all around.
And that's why anything we do is going to be methodical and incremental.
All right. April 17th puts us less than 2 weeks away from May 1st, which is the date that you have circled on the calendar, shooting to reopen the state. As we sit here tonight, how doable is that?
Well, let me first say the date that I have on the calendar is April 30th, that the guidance we have today, the stay-at-home directive, goes through.
So even less time.
Well, but the point is we're going to know so much more a week from now. And we have a full 2 weeks. We're getting data every day in terms of contractions, hospitalizations, and the whole idea has been to lower and eliminate as many of the deaths and contractions as we can. So let's follow the data. Dr. Fauci and Dr. Deborah Birx have put out a great document from the Centers for Disease Control. Those are the folks that guided us to where we are today, and they'll help guide Arizona out at the appropriate time.
Right. But again, do you think that April 30th or May 1st is a doable date?
I think there's possibility. I'm aspirational and I'm optimistic. What this next week looks like and the following week is going to determine. And it's not a light switch. It's not something you turn off and on. It's more like allowing more oxygen into our economy, and to do it in a way that's responsible. Because what we don't want to do is go the wrong direction. Right now, we've avoided what's happening in New York State and Louisiana. Louisiana, even California.
Absolutely.
We're in much better condition and shape than any of those places.
One question.
It's a testament to the people of Arizona.
One question on the economy before we go to a break. You have a tremendous amount of pressure coming at you because the state has lost so much money from tourism on down. Talk about the pressure that you're feeling from businesses to get things going.
Well, listen, the pressure I feel is to make the right decision for the people of Arizona at the right time. We've saved for a rainy day in our state. We have $1 billion in that rainy day fund. We had the largest surplus in the history of the state when we kicked off in January 13th. We're going to find a way to navigate through this as a state. I'm more concerned about the person that works paycheck to paycheck, the small and medium-sized business. So we're going to bridge between here and the other side of this pandemic and allow those folks at the right time to get back to work and get reopened.
All right. Hold that thought. We will come right back with more of Governor Ducey right after this. Welcome back as we continue our conversation with Governor Ducey. Another issue we're seeing, Governor, during the pandemic, continuing national shortages of PPE for healthcare workers and first responders. Where are we at as a state?
Well, our state has been focused on getting this into our hospitals for doctors and nurses and emergency medical responders. Now, there's folks that need this beyond the hospital. That's the correctional officers, firefighters, and police officers. So we believe that our hospitals are now in a position where we can help solve this problem for others that haven't been able to acquire this. And we are hopeful on a number of other fronts around elective surgeries, but we're waiting for the surveillance data that we receive from the hospitals before we can do that, because the doctors and nurses do have to take priority right now.
The president has talked about the reopening of the country as almost like a puzzle. So for you as the governor of Arizona, what is the first piece of the puzzle? The
first piece of the puzzle is what's the right thing for Arizona. Of course, I get to lead a conference call with all of these governors and listen to the video teleconference with the president and other governors. So we've learned a lot in Arizona, so we've been able to plan and prepare ahead. But my only concern is what's the right thing for Arizona at the right time.
So what is that?
Well, we're going to know. We're going to follow the data.
Yeah.
You guys are the ones that say facts, not fear.
Right.
I'm not going to guess. I didn't guess on the way into this.
Yeah.
I don't want to guess on the way out. But I am hopeful. What we're seeing, what you can see at azhealth.gov, this is encouraging in comparison to where we've been.
As the curve flattens, and it is flattening in Arizona, it gives us all a chance to sort of catch our breath, hopefully financially, emotionally, and every other way. But we also know that in the fall, this is likely coming back. So what have we learned when COVID-19 Part 2 comes back and we're not caught as flat-footed?
Well, I think we've learned a lot, not only around COVID, but just how to deal with any virus. That's the washing of the hands, covering the cough. If you're sick, stay home. Who would have thought you would ever say that? We grew up in a time where you wanted to demonstrate your work ethic. These are the type of things where we can slow the spread. And I think we're going to be socially distancing for some time. That's going to be part of this reopening of the economy. We're not going to go back to normal. Normal is something we're going to see into the future. We're going to ease into that with this space in between individuals.
All right, we promised to get to a couple of viewer questions. This one is from Stephanie and Eloy. She says, once people get back to work, are we still practicing social distancing? And you talked about that a little bit. And do you foresee, Governor, a situation where people will, despite the fact that they can gather, let's say they're at a movie or a Cardinals game, have to wear masks?
Well, I would say movies and Cardinals games are way off. When you see the large, big gatherings, that's when you'll know we're closer to normal. The social distancing is going to be important, and we want masks available for everyone who wants to wear a mask. And I think when you talk about some of our service industries, if we were going to go back to dining inside restaurants, this would be something that would give the customers a lot of confidence.
And when you talk about the situation as a whole, what will be the toughest thing for Arizona to recover from?
I think Arizona was leading the nation in economic growth and development going into this, and I think we can lead coming out of it. We've got to do it in a responsible way. The first priority has still got to be public health, and we're going to be dealing with this for some time. The virus isn't going to go away. We're going to be in a position to care for the people that need that from a hospital or a ventilator perspective, and eventually we'll have the vaccine. These are all things that are going to happen in the future.
It's the new new normal for all of us. Governor, thanks for coming in tonight.
Thank you.
All right. Governor Ducey with us here in studio. There's